Medicare reform could be coming sooner than we think, as we have a group of senators calling on President Biden to make some necessary and much-needed changes to the Medicare program. That's exactly what we're going to talk about in this video, so let's get into it. But hey everybody, welcome, and thank you so much for joining me. If you haven't done so already, or if you happen to be new here, please make sure to hit the subscribe button right down below the video, as I am your one and only daily advocate. I'm back every day to keep you updated, answer your questions, and do whatever I can to help you out through this time. Thank you for your support. Let's talk through this. So we have a group of 17 senators who have written a letter calling on President Biden to make the following changes to Medicare. Number 1, lower the eligibility age. Number 2, expand benefits to cover hearing, dental, and vision coverage. Number 3, implement a cap on out-of-pocket expenses for traditional Medicare. And number 4, allow the program to negotiate prescription prices. First off, wow, that would be amazing, right? I mean, think of that. Let's go through these one at a time, first off. So first off, before we do that, let's just say this. If you're somebody who has Medicare, if you don't have a supplement to your Medicare coverage, you're probably foregoing services and care like hearing, dental, and vision simply because those services and that type of care can be really, really expensive if you don't have a supplement to help you out cover those expenses. So just think, if they implemented the coverage and the expansion of Medicare benefits to start covering these essential services for people, that would be huge. I mean, think of that. That would be such a burden off of so many people. But really, I mean, honestly, how many people out there right now who have Medicare probably are not getting any type of dental or maybe vision coverage or services simply because it can be very expensive? Let me give you a quick example and a little story about myself. I'll make it really quick, I promise. So, I have private insurance, right? So I pay for my own insurance myself. I do not have dental coverage. Well, the other day, I called my dentist because my insurance changed as of the first of the year. So I called the dentist the other day and I said, hey, I'd like to come in for just a regular cleaning and checkup. I don't have dental insurance. How much is it going to cost me for just a cash pay, an out-of-pocket pay? And they're like, let me look. They looked it up and they're like, it's going to be $316. I was like, you're kidding, right? Seriously? You think I'm going to come in and have somebody scrub around on my teeth for 20 minutes and pay you $300? It's not happening. Seriously. And I'm guessing many other people are probably in that same position. There's just no way that I can justify paying $316 to go and have somebody literally clean my teeth for 20 minutes. Not happening. And I'm guessing that is probably the case for so many other people. So I wanted to give you that quick example because, I mean, seriously, these services are incredibly expensive. However, these 17 senators in their letter writing to President Biden, they're saying, hey, you know, we need to expand these benefits. The program was first implemented and started in 1965, and it's been an incredibly successful program ever since. However, it is time to change the program. It is time to reform the Medicare program and expand it to these necessary benefits: hearing, dental, and vision. That would be incredible and really, really powerful for so many of you out there right now who need these benefits. Not only that, they said something in their letter about offering these services to older adults and the disabled. Yeah, once again, let's help these people out. Seriously. These are by default people who are usually lower income people who probably don't have an extra $300 laying around to go to the dentist and get your teeth scrubbed around on for 20 minutes. You know what I mean? Yeah. So at the same time, let's talk about lowering the eligibility age. So this is like a tiered approach. Over so many years, they would lower the age quite a bit and start expanding this out for Medicare for all. That's part of this whole proposal that they're offering to President Biden. At the same time, putting a cap on out-of-pocket expenses. Once again, could you imagine that? For some of you out there who are paying tons and tons of money out of maybe your very small fixed income from Social Security out to medical expenses, again, putting a cap on out-of-pocket expenses, this would be huge as well. I mean, all around, this would be such a nice implementation into this program to help so many people, once again, in another way, lower out-of-pocket expenses on so many things here, right? So at the same time, when can we expect this to happen? Well, here's what they're proposing. President Biden is going to be unveiling the second portion of his infrastructure package here in the next couple days in front of a joint session of Congress. Well, at that same time, they're wanting President Biden to include this reform for the Medicare program within this American Families Plan. That's what it's called, the second portion of the infrastructure package. So they want it to be within there. As it currently stands, we don't know what's exactly in this American Families Plan. There has been some information that's been leaked, basically saying here's what is in it, but we don't know the exact details of the plan quite yet. However, there are a lot of different proposals right now floating around out there to be added into this second portion of the infrastructure package. This reform for the Medicare program is just another one of those. So we'll have to see what's actually in this plan when President Biden unveils this thing here over the next couple of days. And then we'll have to see how all of these senators for this push on Medicare reform, as well as everybody else in, the House of Representatives, senators, and everybody else calling on all of these other programs to be implemented, like a fourth stimulus check, recurring stimulus checks, all of these other things to be coming out in this next infrastructure package. Either way, I mean, if they added some of these necessary programs into it, like a fourth stimulus check, maybe amending the Medicare program to implement some of these changes that they've proposed, as well as some of these other programs out there that are floating around, I mean, this next portion of the infrastructure bill, or human infrastructure as they're calling it, could actually be pretty powerful. At that point, we wouldn't even really need to call it infrastructure. I mean, we could just call it a straight up stimulus package at that point. I mean, it's basically already that, but they're not exactly calling it that. But either way, we have once again another proposal on the table to hopefully change the Medicare program. And really, this would be huge for so many of you out there right now who have Medicare. I mean, I don't know what the exact number is. I haven't looked it up in quite a while, but I think it's something along the lines of like 70 million Americans receive Medicare. That is a huge, huge number. I mean, seriously, that's a lot of people. That's like what? 1 in 5 people in our country? Something like that? 1 in 5? I mean, that's a huge, huge percentage of our population in the United States. So this would reach a ton of people if they actually did this. We will have to see. But this is just, another proposal. I want to continue to keep you updated with everything that's going on right now and all of the proposals that are on the table. But either way, it's going to be very, very interesting here over the coming days and weeks for sure, after we get the official unveiling of this infrastructure package and to see what's actually in this thing. And then once we get all the details, you're really going to start to see all these proposals kind of coming into the light and people starting to back these things up, basically saying, hey, check it out. This infrastructure package, or the human infrastructure package, is a pretty good one. There's a lot of great programs in here and a lot of good money being allocated for different purposes. But at the same time, we should really add, X, Y, and Z into the plan as well. So it's really going to start taking shape here over the coming days, weeks, and months. I mean, in a couple of months from now, realistically, we should have like the basic outline and basically know everything that's going to be in it down to, the exact within the months. But I mean, literally in days and weeks here, it's certainly going to be very interesting to watch this thing evolve over the course of that amount of time. Because as of right now, it's basically just like the basic framework saying, here's what's in it for now. But as we all know, everything is subject to change, as we've seen so many times over the last 12 months with all of these different stimulus packages that have been sent out and implemented. Certainly very interesting, right? So either way, I will keep you posted with all of this, but I wanted to bring you this because some of you have been reaching out to me saying, hey, what's going on with this changes to Medicare I've been hearing about? Well, this is what it is. So some pretty cool changes in there for sure, and I think this would really, really impact a lot of people if they actually implemented and brought into action some of these proposals that we're seeing especially for Medicare and stimulus checks and all this other stuff going on. So if you haven't done so already, please make sure to hit that subscribe button right down below the video, and I will keep you posted, as I am the one and only Daily Advocate right here on YouTube. Thank you so much, everybody. Feel free to share this video with your friends, family, and social media, and I will be back soon with another video and more updates. Thank you so much, and I'll see you in the next one.